Okay, we're going over Chapter 12, Module 9, Understanding the Long-Term Care Patient, starting on page 105 in Chapter 11 of your book. And this chapter has everything in it. So it has anatomy and physiology. It highlights all the main diseases that we encounter, not all, but the more frequently seen diseases. Okay, so a lot of objective, but I'm going to sum them up by saying we're going to describe the body system's functions and how it relates to aging, and then go through many different diseases, including identifying and describing Alzheimer's disease, respiratory disease, cancer disease and treatment, diabetes, seizure, stroke, and the management of those and the management of behavior too, that go with some of those. Okay, so recognizing emotional and social needs is huge because especially with the elderly, but with anyone, but I want you to think of it like this. The elderly have lived their life, right? And there's going to be chronic diseases that come up that we can't fix. So, but what we can do is make them more comfortable and know that there's emotional changes with not being as independent or feeling as well and work with those emotions. Okay, so and it's difficult. So as we say, it's difficult in number two here from being independent to depending on others for care. And so be sensitive to those clients' needs and try to help them adapt and offer reassurance or at least your time. By offering your time, you could be a good listener and ask questions without prying too much. Encourage friendship and participation in activities and social events. So if you're in the assisted living, try to get them down to go down to some of the meals, and there's always activities, and then sometimes encouragement helps, right? And then if you're at the home, hey, do you have friends, or do you want to call your friends over? That type of thing. Even though you're there, they may feel uncomfortable having their friends come. And with COVID, I think we know, mental health issues have gone up. It is so vital to have contact with others for your health. So if family and friends come over, allow them time and space for private visits when you can. So if you're in the home doing home care and people come over, maybe those tasks recall your agency are not all so important. It's more important for them maybe to sit there and talk to their friends than to go on that walk today. Again, I want you to remind that you need to communicate that with your agency, though. With body changes may be behavior changes because remember, it's normal for anyone who's dependent on others to experience fear and frustration. And these feelings can bring out the worst in people. So try to look beyond the behavior and figure out what the underlying need is for comfort or support or it could be emotional support. Always respond with kindness and respect. So let those nastiness fly off your shoulders and try to understand the reason again for the behavior. Control your reactions. Better to walk out of the room or, why don't you have some time than to argue. Never argue and try not to get upset. And if you are, it's better to walk away. Okay, to conclude with that, let's review. So when you're with a person, stay calm. Do not argue. Do not take their anger personally. Be patient, talk in soothing tones. And if the resident gets aggressive, get help, walk back, leave the room. Make sure they're safe, but sometimes it's better to let things fizzle out. If you are in an agency or even in an assisted living, you need to tell your management or your agency that the person is getting aggressive, though, because this is, even if it's the first time, you need to tell them just so that they're aware and so you can figure out how to manage these issues. Okay, so here are body systems and their functions. So when we say by body system, There are 8 listed here: circulatory, digestive, endocrine, integumentary, musculoskeletal, nervous, respiratory, urinary. I want you to be able to recognize those systems, okay? This is part of anatomy, is just the way the body is made up. And then the word physiology is what do those systems do? Um, and sometimes, if you're in different books, there may be more than 8 systems because they break out the muscular by itself, skeletal by itself, and the circulatory. They may break out the lymph system in that, right? So, but these are just so you know, there might be a little differences, but they're all there. It's just sometimes they combine them. Okay, so circulatory, heart and blood vessels, and it pumps the blood, but that's obviously a dumbed down version of what they do because the blood brings oxygen and it takes away the carbon dioxide and the waste products, so it does more than that. So this is a simplified version. Of course, they have whole semesters on anatomy and physiology. Digestive system, I'm going to go through just what they do. Breaks down the food, absorbs nutrients, eliminates waste. One system that I want you to be very aware about, because we don't think about it as much, is the endocrine system. It has endocrine glands and it regulates, it makes all your hormones. So it's not just your reproductive hormones, hormones for growth, development, metabolism, how we helps our immune system, just everything. So it's really a chemical based um, reaction system, and it's very important. Okay, so it regulates metabolism, stores fat for energy, regulates hormones. So it regulates its own hormone, repairs injured tissues. It does a lot more than that. Integumentary system is the just your mostly your skin, biggest organ in the body, and hair and nails, but controls temperature, keeps the germs out, right? If you have a cut. But again, it does more than that, but those are the simplified versions. Muscular skeletal is your bones and your muscles and your tendons and ligaments. So it supports and shapes the body, but it also enables movement. The nervous system is the brain, spinal cord, and nerves, gathers and sends messages throughout the body. But remember, all these work together. That muscle movement is not going to occur if the nerves aren't giving it the messages to move. Um, and then the respiratory system, and the main thing is to brings in oxygen and removes carbon dioxide, which is a waste product. And urinary system, kidneys are huge, a lot of chemical reactions in the kidneys. And then the holding areas are the ureters and tubes, ureters, bladder, and urethra. But it maintains fluid balance, but it cleanses our blood out and eliminates waste. Okay, so let's go through some of these systems and what we can do as healthcare workers, adapting to physical changes in the cardiovascular system. So you could see here the heart. The heart pumps the oxygen, and the red will be the arteries that are taking blood away from the heart, and then the veins bring it back. And truly, if you would see oxygenated blood in the arteries, it's a brighter red, whereas the blood that we usually have drawn in our arms for lab work is a dark crimson color, right? Maroon. And the oxygen makes it a brighter red. But this is how they always show it: red for arteries and blue for veins, heart pumping. But so some of the cardiovascular changes that could happen with age or with illnesses, we lose a little pumping power in the heart. The arteries and veins get narrower. They lose their stretchability because they're muscles too. They're smooth muscles and they don't have that elastic. And then what happens, it reduces the blood flow, less oxygen to the whole body, and we'll have slower healing. Plus, we may have swelling in our feet and other parts of our body, but the feet usually get it first. So I'm going to move down to stimulate circulation with movement. It's really good to do movement. I love to do the point and flex exercises on the legs. That helps get rid of some of the edema. And remember, people may get tired very easy, so you have to pace activities like shower, take a break. That's an activity. Get go out for a walk maybe an hour after they rest so they can get their oxygenation back. Um, Elevate the legs down here because they often swell and keep those extremities warm. Okay, the digestive system next. From what we eat goes down through your esophagus into your stomach. The liver is part of your digestive system because it makes some bile, which breaks down fats. The pancreas has the insulin and also digestive enzymes, so they secrete that into through the intestines, and then it goes into the small intestines, these first, and that's where all the absorption of nutrients takes place. And then it's real watery in the small intestines, and then it connects right here to the large intestine. That little thing hanging there is the appendix, and then it goes around, and the large intestine, the colon, also called the colon, will part of it. It does make some vitamins, but it also um, reabsorbs fluid for the body, especially if the body's dehydrated. So it always reabsorbs fluid. However, if the body's dehydrated, it makes the stool, it reabsorbs the fluid, and it makes the stool very hard. And that's a huge problem in older people. They get dehydrated easy and then they get constipated. So, potential problems with the elderly is that they have less saliva production. So, their mouth is dry. So, give them lots of fluids. More difficulty swallowing, their teeth may not fit, or they lose teeth, less taste, more frequent constipation. I highlighted that. More indigestion. So, what can we do? And I highlighted what I thought is important. Encourage fluids, give them time to eat. If they have dentures, make sure they're in. Encourage frequent toileting and establish regular bowel movements. So really, you have to keep an eye on that. Ask them, did you have a bowel movement today? Because why? Fluids will help increase that. High fiber foods, fruits, vegetables, which has fiber and fluid in it, and then walking around will help keep them regular. Okay, adapting to physical changes with the endocrine system. And again, the endocrine system has glands and they all make hormones, and it's so important. So we're going to emphasize some that really the two that are affected most often with the elderly, and that's going to be the thyroid gland right here, and also the pancreas because of the insulin. The insulin is a hormone for diabetes. But the pituitary in your brain, it controls everything. So, but let's go through the potential problems. First of all, decreased hormone levels with the elderly, less body water, so weight loss, less ability to handle stress, more likely to become ill because it also has to do with your immune system, the hormones, and you take longer to get well. So what are we going to do for people, especially the thyroid? The thyroid is your metabolism and how you feel, your activity level. And it doesn't affect all, but a lot of older people do have thyroid problems, um, and they might be on medicine for it. So first of all, to keep them from getting infected, we're going to wash our hands and keep the areas clean. But try to reduce their stress and avoid schedule changes. Older people usually like a schedule and offer encouragement, not criticism. That's more for the thyroid, but it all could be affected. All of it is reduced. Your adrenal glands is where your adrenaline is, really norepinephrine. But can you, in a condition, it gives your adrenaline to give you more energy, but it also does the other half where it lets you relax. So endocrine problems are really important. The doctor that they see would be an endocrinologist for these problems. for or diseases. And so that's who a person who has diabetes would see an endocrinologist. Okay, now we're on musculoskeletal. And so what happens when we get older? Muscle atrophy. Right here, it's bold. And that means wasting away a muscle. And if your muscle wastes away, you're not as strong. Um, Bones lose density and become brittle. So osteoporosis, more in Caucasian white people have that. But again, these are generalizations, but most of this happens to some degree to everyone. Joints are less flexible, gradual weight loss. So what do we do with the elderly? Definitely try to avoid falls. If they get a hip fracture, they may not die then, but the statistics show that within 1 year and then 5 years, that the death rate is much higher for those people that had experienced a hip fracture. Position and walk them as much as you can, as long as it's in the plan of care. So if you're in a home care, if you're doing home care, does the agency want you to do that? Is that on your list of things to do? And the same thing in assisted living. Um, Encourage a range of motion exercises. So that could be doing this, and maybe you do it with them, especially if you're doing home care. You know, put on some music or get something on the live stream or on TV to do it with. You use your phones and or their things so you could get some of those and you do it together. It's good for you too. Okay. So here we're adapting to physical changes in the nervous system. So the elderly, how do they adapt? So what is the nervous system? It's the central nervous system is the brain and the spinal cord. The peripheral nervous system has uh, goes out to your periphery, your arms and legs. Okay, and so what are the potential problems? There's decrease in brain cells. Isn't that sad as you get older? Less blood usually being circulated because remember the cardiovascular system often doesn't work as good. And so people tend to forget recent events. They need more time to process. So if you ask them a question, it's not like they can't answer it, but they may need more time to think about it. They call that processing and formulate an answer. So, what to do? Do not rush the person, allow time for decisions, avoid abrupt schedule changes. I notice usually older people don't like that. Encourage thinking, reading, and mental exercises. And encourage, which I don't have here, is physical exercises. They're finding that physical exercises help because of the circulation, I guess, with better memory. So I need to write that in. Okay, so I wrote that in. Encourage physical exercise. They're finding that's even more important than the mental exercises like doing puzzles and things like that. But the other thing is, it's better for people to do different exercises and things they don't usually do and things that don't come easy. That's what makes their brain stay in shape too. And this is a little diagram to show you how the nervous system affects all other systems. But all of our systems are interrelated. And let's not forget the reproductive system in the elderly. Okay, so what happens? Potential problems. The males have a harder time having an erection or keeping an erection. There's medicine for that. Menopause in women, decreased hormones, and the men have decreased hormones too. So sometimes they're treated with hormone therapy. Reduced vaginal lubrication for women, and there's medicine for that. Um, and so what can we do though that just recognize that all ages are sexual beings and it's funny, I'm older and if I go and kind of hug and kiss my husband, even in front of my adult children, they're like, oh my gosh, don't do that in front of us, right? Oh, it's cute. Well, it's not cute. It's just, I mean, you don't say that to a 22-year-old get married. Oh, you're so cute, kissing your husband. So it's just, so try to keep that in thought because it might be degrading, right? We don't want to be cute. Babies are cute. We're adults. Allow time for privacy and because they for their sex life. So no, they will be having sex probably, and that they may want be willing to discuss that openly, never tease or criticize or embarrass a person. Okay, let's go over the respiratory system with aging. So what happens? Potential problems. Lungs lose their strength, their elasticity, their smooth muscle too, and they're just not as strong. Uh, they may have more deposits in their lungs, from pollution, harder to breathe, increased risk of secretions accumulating in the lungs. And what to do? Get the person out of bed often, encourage exercise, encourage deep breathing and coughing. So here's another system that they broke out, and I didn't mention in the beginning the sensory system. And this is, let's go through this. It's smell, sight, hearing, taste, and feeling. Okay, and they all get reduced. So usually older people, usually again, reduce vision and hearing, decrease taste and smell, reduce sense of touch, less likely to feel pain in some areas. Voice muscles lose strength, so it's harder to hear them. So, of course, we're going to ask them to use their glasses, make sure they're clean, hearing aids. Speak slowly and clearly is always an answer to a test question because we talk fast. Listen carefully to the patients when they talk or the clients and encourage good nutrition, even though it may not taste so good. Okay, the integumentary system, primarily your skin, which is an organ, but it's also your nails and your hair. Big thing, dries easier, less elastic, so it tears and easily. So skin tears are a big thing. That's why when we're holding someone, I ask you to hold them from underneath instead of like their arm, because this could just tear their skin, boom, like that. So if you're holding it, it won't tear as easily. They may lose fatty layer. The blood vessels weaken, so there'll be little breaks in the blood vessels, even underneath the skin. Nails get thicker, tougher, hair turns gray, falls out, thinner hair, skin bruises easily. So to continue with the integumentary skin system, a big thing if someone's bedridden or they're not moving around, position them at least every 2 hours if they're in the bed to prevent pressure ulcers, openings in the skin. Smooth the wrinkles from linens because it gets uncomfortable. Keep the skin clean and dry. Use lotions for moisture. Remove any kind of safety hazards that they might bang themselves on. Use extreme care when clipping the nails. First of all, if they're diabetic, you never clip their nails. Always make sure you're allowed to help clip their nails because what happens is if you clip them too close, they get infections. And remember, they're older, and it could cause a big deal where they have to be on antibiotics and never clip anyone's feet nails, the toenails. I'm sorry, toenails. And again, encourage fluid because the fluid will help their skin. Okay, so here's your urinary system. I'm going to start from the bottom. The urethra, that's why we have to keep the bacteria out. So that's why we wash from front to back. So none of the rectal bacteria could go into the urethra because it likes to crawl up those little bacteria into the urinary bladder and give you a bladder infection, often known as a UTI. The problem with that is this is just a muscle with a holding area. If the UTI gets bad, it will go up the ureters and can lead into the kidneys. And the kidneys have a lot of um, physiology in them that they're doing a lot of work cleaning out our whole system, detoxing our waste, getting rid of our waste that we take, and getting rid of water. Okay, and different chemicals we don't need, different electrolytes we don't need. So, but as we get older, reduced kidney function, and our bladder, another muscle, we don't have as much control. We may become incontinent, more frequent urination just because it probably doesn't expand as well and contract as well. Remember, it's a muscle. Um, so what we want to do though is encourage a lot of fluid. Our kidneys love fluids going through water. It loves water going through it. If the person's incontinent, don't criticize them. If they're not incontinent, try to have them, and they're trying to get so they're not incontinent, and so they're not having accidents. Toilet them at least every 2 hours because we don't hold as much fluid. Um, and if they're going to urinate, have them try to sit up and because they'll empty their bladder better and give them time. Try to keep them clean and dry, clean to prevent those UTIs because if that bacteria goes up in their kidneys, then they're going to lose more kidney function. Okay, now we're on page 110 in your book, and it's dealing with confusion. So let's go over some definitions. First of all, dementia. Dementia is a disorder that impairs a person's mental ability. They have decreased ability to think clearly, they may have personality changes, and impaired judgment. So it's a symptom of dementia is a symptom of a brain malfunctioning. So there's many types and many causes of confused behavior, and some of the behavior, some of the dementias could be reversible, but most, which are caused by degenerative disease or trauma, are not reversible, but we have to figure that out, which is reversible, which is not. So knowing that if you're dealing with a person who's confused or has dementia, it may affect their emotional state a lot. And it can result in behavioral changes. They could get aggressive, they could get upset because they often will know they're not thinking right, and how disturbing is that? Um, and making decisions becomes really difficult. And they may even be people with severe dementia have to be reminded of activities and how to do the ADLs and remind people how to eat and feed themselves. Okay, as we said, we have to figure out, is it irreversible dementia, which is caused by like degenerative disease or trauma, or is it some condition that mimics dementia? They're definitely confused, but it's treatable. So drug interactions, and as they add on more medications, anemia, nutritional deficiencies, and hormone imbalances could get people confused. Thyroid problems, and then of course there's brain tumors, depression, head injuries, hydrocephalus, which is another brain, water on the brain. But we have to figure out, is it treatable or is it not? Not we, but the healthcare team. So dementia is considered irreversible. It cannot get better when caused by Alzheimer's disease, stroke, or certain diseases that affect the nervous system, the cardiovascular system, or even the respiratory system. They typically react with, but the two main are Alzheimer's and stroke. Okay. So people typically react with denial, fear, anger, and grief because they know they're getting confused, but they're not that confused. And when they find out about their diagnosis, it's very hard. Some resist help, and they don't appreciate the assistance because they used to do all these things themselves and make their decisions. So the world really becomes a frightening and strange place. Hey, I want you to know that many of the memory care units are in assisted livings. They're not in skilled nursing, so there's plenty of jobs out there. And if you kind of specialize in this, it's hard on the families, but it's very interesting if you're a caregiver because you don't know what that person was like. Instead, it's you're trying to keep someone happy, keep them doing things, and so it's kind of a creative it brings out the creative person in you because every day is a little different. So this is a good place of employment. So before you go somewhere, if you're going to do memory care, just look up some things of how to work with people. And we have videos that you're going to work through on this module. In your book, it goes over reality orientation on page 110. I'm going to tell you we don't do this very often, especially as a caregiver. Reality orientation is someone who has a reversible confusion, right? So it's not someone with Alzheimer's. And so I think of this as maybe someone who had a car accident or who was in a big surgery and was on a bunch of anesthesia, and we're trying to bring them back to what happened and what day and time it is. So then you repeat the person's name, you identify yourself, you keep saying, oh, it's August, 15th or whatever day it is, and to bring them back to reality. So you could read that over in your book, um, but I want to more emphasize the validation therapy is what we'll use with Alzheimer's. So three main therapies with with people with irreversible, and that's uh, irreversible dementia, which is primarily Alzheimer's disease, and then people with these small multi-infarct strokes. So they're little strokes all over their head. First of all, they can't come back. They can't get that brain to work better again. So especially with Alzheimer's, so you're going to validate their feelings and where they are in their life. They might be back when, because people tend to go back in time of when they were younger. Um, and so you kind of just go with the flow. If they're getting up to go to work, then you're say, oh, okay, well, let's get you dressed. You kind of go with the flow. A lot of times they forget what they're doing. Let's have some breakfast first. Oh, and so it's kind of like we're bribing people and to get them do what we want to do, but we're keeping them happy. We're validating where they are. And you are going to meet them on their own reality, right? Where they are in their life and allow the person to experience their feelings. Don't say, oh, it'll be all right. Or, they say, I'm waiting for my mom to come and visit. Well, their mom is older than them, so they're probably deceased. Um, don't say, oh, your mom's been dead for years. Just say, oh, well, let's wait over here and maybe do some activities while we're waiting. You don't want them to relive that experience of losing their parent, right? Another one is music therapy. Oh my gosh, it brings back memories of people's events. And so watch the film that we have in the modules. It's amazing how these people are just kind of all crumpled up. And then when they listen to the music, they get energized. Um, and then reminiscing, that's a good thing that you could do with people, recalling fond memories, maybe if they have picture books, and that really is something they like to do and go through that with them. Picture books, photo albums of their families. Okay, Alzheimer's disease. It's a and it's known as AD, a brain disorder with no known cure at this time. It is irreversible, so it gets progressively and progressively worse and slowly steals the mind of its victims. There are more than 5.5 million people in the United States that are affected, and the number keeps growing. It's a terminal disease. That means it will eventually, you'll die from it. That affects each person differently. But this is one disease that we put people on hospice for. Okay, Alzheimer's disease is broken down into three phases. Phase one is they're still living at home usually. Their subtle changes, reactions are slowed, their judgment is impaired, decisions are getting difficult, they know something's going on. Okay, phase two. So they get increasingly worse, more forgetful, more confused. This is where they start needing supervision. So you might be called in to do home care with a person because the family's afraid they're going to walk out and leave the house and get lost, or they're going to put something on the stove to cook and forget it's on the stove and could burn the house down. So they need supervision. They need help with activities, daily living, which is brushing their teeth, getting dressed, going to the toilet. They could have mood swings, which often happens, and unusual behaviors. And their family would say, well, they're never like that, but that's part of the disease. They become more disoriented, more forgetful, can't remember people. They have more difficulty speaking or understanding language, and a shorter attention span. Phase two is where they often come into the memory care units in the assisted livings also. And so those memory care units in the assisted livings are locked units, they call them. So people can't get out. Well, so they usually have courtyards. They could get in and out of their room, walk around in the activities area, um, but they can't leave the building because even the courtyards, the outdoors areas are locked, so they can't get out. And then they're phase 3. So this is also where they're still in a memory care unit, maybe a skilled nursing, or they could be at home, but they're definitely going to need 24-hour care. So they're totally dependent and they need constant supervision. They difficulty communicating, judgment is not good. Often don't recognize loved ones. That's very hard on the family. And they lose their ability to walk, speak, swallow, control their bowel and bladder. Definitely can't follow directions, maybe, or have trouble with that. Become bedridden, confined to a chair, and this is where they're at the start to be on the end of life because they could die from the Alzheimer's, but then they also die from different diseases. They're immobile at this place at this time. They forget how to swallow, so they could have aspiration pneumonia. So there's more complications also. So again, with Alzheimer's disease, support the emotional needs, accept their reality, and validate their feelings. If they're crying because they missed the bus to go to school, those are real feelings. Um, um, Music therapy is often soothing. They like to hear music, usually of the time that they were between their late teen years to or teen years through 30 years old. So if you don't know what kind of music to get for them, that's usually what they like, unless you can find out from family. And don't frustrate them with too many questions. Let's say you're going to home care or in assisted living in the memory care. Don't say, "Oh, I took care of you yesterday. Remember my name?" No, it's just frustrating to them. Just introduce yourself again. So not too many questions, quizzing them more or less. Okay, cognitively impaired. First of all, impaired, we use that a lot. So mobility, impaired mobility, and it's a decreased ability to do movement. So impaired cognition is the mental process. So first of all, cognition is the mental process of learning and acquiring skills. So that means if they're impaired, this is not working well. So their mental function, um, they're impaired and they're limited in what they can learn and remember. So this could be someone with developmental disabilities to someone who just had a stroke and different reasons for cognitive impairness. Could be even these cues are also good for Alzheimer's patients, right? They're not going to learn new things, but as they're going down and being able to do less, we're still going to provide some of these treatments with them. So, some can learn self-care, and some are totally dependent on you for their care. Repetition is important when we're trying to work with people, even to get them dressed, right? Always break down the information into simple pieces. So that goes with Alzheimer's or any cognitively impaired. And so, what does that mean? Let's say I am putting on a shirt. Um, okay, put your right arm through the shirt. Okay, now I'm helping you pull that shirt around the back. Now put your left arm through the shirt. Now can you pull the shirt together and button up each button? So it's not like just put your shirt on. Okay, so what can we do for them? Use verbal cues. Cues are instructing them to do certain things, just like I said about the shirt. Or if we're feeding a patient cognitively impaired, go ahead and chew. How's the food? Oh, did you swallow that? Do you need another bite? Those are all cues. Use that client's name and treat them like you would treat any other client or resident. Okay, chronic respiratory disease. So chronic now we're on page 112 in your book and we're starting with another disease, and this is respiratory diseases and chronic obstructive pulmonary disease. It's called COPD. And so there's permanent lung diseases that interfere with the normal breathing and will worsen gradually over time. The symptoms: shortness of breath, wheezing, chronic cough, and reoccurring respiratory infections. And so COPD is one of these two, chronic bronchitis and chronic emphysema. Okay, most common causes include smoking is most common, but there are people that haven't smoked that have emphysema because they've been exposed to chemicals like in paint factories or air pollution, lung irritants, secondhand smoke. Okay, with chronic bronchitis, their breathing tubes get inflamed or swollen, and they create a lot of mucus, so they're constantly coughing up the mucus, and it makes it hard to breathe because it blocks the breathing tubes. Then emphysema, the little air sacs, and there's a video on this, become really stiff, and they're unable to hold enough air, and they're unable to get the oxygen in and the carbon dioxide out. So they're taught to position themselves differently, and we have to be alert for breathing. So let me show you the positioning. So a patient would be kind of forward, leaning on their desk and trying to breathe like that with emphysema. And a patient that has the emphysema in the morning, they're actually told to go in the bathroom, in a steamy bathroom, and lean over and try to cough things up. If they're leaning over, it's easier to get the mucus up. It doesn't have to fight gravity. Okay, so what is cancer? It's a malignant tumor, which is a growth of abnormal cells that originates in one part of the body and an organ, and then it spreads to the other part, and that's called metastasis. The most common cancers are lung, colon, prostate, breast, rectum, and uterine cancer, but there's thyroid cancer, there's cancer of the blood, leukemia, um, and the factors that contribute to cancer, so smoking, cancer that runs in the family, certain chemicals, certain viruses, um, the radiation, alcohol, and your diet can all contribute to getting cancer. So here are the warning signs. A change in bowel or bladder habits, sore that doesn't heal, unusual bleeding or discharge, a lump or thickening like in the breast or the testes, difficult swallowing or ingestion or eating, um, obvious change in a wart or mole for the skin cancer, and a nagging cough that doesn't go away or hoarseness. So, coping with cancer, the most common treatments for cancer are surgery to remove the malignant tissue, right? Breast surgery, um, lung surgery, radiation, which they have high doses of radiation that to these they try to localize it into the cancer cells to kill those cancer cells only. And then chemotherapy, which is medications that travel through the bloodstream to destroy cancer cells anywhere in the body. Now, all of those are going to kill cells around it. The surgery, the radiation, unless it's directed right into those cells, it may destroy cells around it. And the chemotherapy, that's why people lose their hair because it kills fast growing cells, which is your hair cells. Anyway, treatment depends on the type of cancer, the location, and whether it's spread or not. Okay, so we have to be alert to the side effects of the cancer treatment because there are a lot of side effects. Decreased energy level, decreased appetite, their appearance is different. Oh, the hair loss is supposed to be with the appearance, the physical discomfort, the nausea and vomiting. They may lose interest in food. Try to encourage small, frequent meals because they usually have no appetite. Skin can become really irritated easily, um, and keep the skin clean and dry. Try to avoid pressure ulcers because their skin is more irritable and can break down easier. Okay, dry mouth and mouth ulcers is also common after some of the treatments. So you want to avoid the orange juice and citrus fruits that could juices that can irritate the mouth, but encourage fluids and soft foods. Take time to listen to residents' fears, concerns, and frustrations, and then report any changes or any problems because there are often some remedies for some of the side effects that they might not have tried yet. Okay, there are a lot of resources if you're working with cancer patients from the American Heart Association or cancer.org. So you could just Google caring for the cancer patient at home. The other one is Alzheimer's, has a lot of resources. So just Google Alzheimer's and there's Alzheimer's resource centers. Okay, we went over diabetes in chapter 11 on nutrition, but let me go through the two types now. Type 1, that's when the body completely stops making insulin, and that is thought to be caused by autoimmune disease where the body, for whatever reason they don't know, starts destroying its own insulin producing cells, which are located in the pancreas, and they're called beta cells. So the treatment is immediately they need daily insulin injections. According to the World Health Organization, that makes up for about 5% of all of the diabetic patients. So the other 95% in the whole world are type 2 diabetes. And this is when the body makes insulin, but it stops not functioning as good as it should. And that's called insulin resistance. So the insulin is supposed to carry the glucose that's in the bloodstream in the cell, and it can't. Remember, I said it's like the insulin's like a taxi, but now the taxi cab or Uber has a few flat tires. Some get into the cell and some never get to their destination. And also, so because it doesn't function well, the body should produce more insulin, but it can't to help with those poor functioning cells. So the outcome is the same, too much sugar in the bloodstream and not getting into the cells. The risk factors, though, with type 2 diabetes is weight is the main risk for most of those cases. Um, so that if you're obese, you have a higher risk of that. Storing fat in the abdomen, it's weird. If you store fat in your thighs and your buttocks, you don't have as much risk as if you store your body tends to store it in the abdomen. Inactivity, so definitely walking and doing exercise helps prevent diabetes. Family history, race and ethnicity. So African American, Pacific Islanders, they have a higher risk of diabetes. Polycystic ovary syndrome, women with irregular menstrual cycles is one of the symptoms of that disease. And then pregnancy. People get pregnant and they'll get gestational diabetes. They get diabetes when they're pregnant. And remember, these were all hormones. So I told you that endocrine system, they all interrelate, right? Anyway, if they've had gestational, it may go away, but they have a higher incidence of getting type 2 diabetes later. And if they had a baby greater than 9 pounds, they have a higher incidence of getting diabetes, type 2. Okay, so before a patient gets or a person gets their diabetic medicine, either insulin or oral stuff, that what will happen is their blood sugar goes up, which is hyperglycemia. The symptoms are, these are the three that are bolded or most common. Excessive thirst, which is called polydipsia. Poly, like a polygon, is many. So many or a lot of thirst. Polyphagia, they're very hungry. Frequent urination, they're polyuria, and in the urine will be a lot of sugar that's coming out. Um, and and they have weight loss. Why? Because none of the glucose is getting in the cells, so they're starving the cells, along with blurred vision, fatigue, muscle cramps, skin is irritated easily. Okay, so what are we going to do for the diabetic? So what are we going to do with it if we have someone who's diabetic that we're working with, a client? First of all, report anything abnormal, but let me show you some of the main things to look for. Monitor and report any food not eaten. Remember, if they don't eat the food, they already got their insulin or their oral medicine, could make their blood sugar go down too low into hypoglycemia. So we want to report that. And even if they don't have the symptoms now of too low, we want to prevent it in the future. So they might want to start adjusting ahead of time. Make sure you provide them with a diabetic diet. So you're not going to be giving them cake. And if you're there cooking in home care, you have to make sure with your agency and the family of the foods that they can have. Okay. Check the feet for signs of cuts, wounds, and sores. They usually can't feel it. They have decreased feeling there, and report that because that's what causes, especially on the feet, below the knee amputations of the feet. Chop those feet off because they get infected and they can't heal it, or amputate the below the knee of the leg. Which means that you're going to cut the, not you, but a physician will cut the leg off because the infection can't be healed. And they don't want to kill the rest of the body and have that infection spread. Do not trim toenails of diabetics or the fingernails. They you, let someone else do it because any kind of cut could grow into a big infection. Report any changes in level of consciousness. Protect against cuts and scrapes. Wear their shoes a lot. They have to wear their shoes because that will protect their feet. Keep clothing and bed covering loose enough to provide good circulation. Provide good skincare, like lubricate it. I think I spelled that wrong. With okay, lubricate with good lotions, and report any changes in the skin color, temperature, pain, or anything abnormal. Okay, again, to go over some of the symptoms. This is someone who's hyperglycemia, high blood sugar, before they get treatment. Now, it could happen when they have treatment, but that means the treatment isn't good enough. Um, it happens over time, slowly, right? So it's caused by not enough insulin, too much sugar, or no treatment at all. It's very gradual, slowly. But this kind of hyperglycemia, because they don't feel it, could lead to blindness, kidney failure, numbness in toes and fingers, stroke, heart attack, because it ruins all the blood vessels feeding all those organs like the heart and the brain. Um, as treatment for hyperglycemia, actually, it's usually insulin. However, if it's not too high, they could use oral medicines first. Hypoglycemia is what I want you to be really aware of. If your patient is diabetic and they're on medicine, either oral medicine or injections, and they start acting a little goofy, here's the symptoms of hypoglycemia. Besides goofy, they're anxious, they're irritable, they may have a headache, they may be fatigued or shaking or sweating, and they just don't act right. They could also be hungry. Those are the symptoms of hypoglycemia, and you need to act on that. So, what are you going to do? The treatment is giving glucose or sugar. Sugar, you give it orally. So you're going to give them cookies. You're going to give them juice, some kind of, all juices are sweet. No diabetic stuff. It has to be the real sugar in there. Could be food, things that are carbohydrates that are digested fast. The ones that I usually tell you not to give them, that's when you give it them. In fact, they are told, they being diabetic patients, to walk around with hard candies because in their pockets, because then they always have some quick sugar that's easy to carry around. And because these could come on very quickly. And that's why I say if people aren't eating right, or having any symptoms, tell your agency or your supervisor because you want to prevent that from happening. Okay, coronary heart disease is the leading cause of death in the USA, and it's caused by narrowing of the coronary arteries. These are the arteries that feed the heart muscle its nutrients. So these little arteries get clogged up with fatty material, plaque, and then it can't see there's a clog there. It can't get through to feed the heart nutrients, and then it causes the heart muscle to have problems. And one of the problems is cardiac arrest because those get clogged up, then the electrical system and the muscle of the heart can't work, and that's the most common reason for people to die suddenly is due to that cardiac arrest, due to the coronary heart disease. Okay, again, the cardiovascular system is the pumping system of the body, but when those arteries get clogged up, they may not cause cardiac arrest, but they could also cause a heart attack because, which a heart attack is also the medical term is myocardial infarction or MI. the heart muscle dies in that area that's not getting any blood. So it just like anything else, when it gets torn, your skin, it scars over. The heart will scar over, but then it loses its pumping power. Um, and heart attacks could be little, mild pain and discomfort, or they could, or and the symptoms may come and go. They could be a bigger heart attack because it's affecting more of the heart muscle and more pain. The amount of pain doesn't always tell you how big a heart attack is because men generally have different symptoms than women, but we used to say any weird feeling from nose to navel, that's your belly button, could be a heart attack. So look at this. Chest pain, and it's usually squeezing and pressure that lasts more than a few minutes. Anxiety, because you don't feel right. Shortness of breath because it affects your breathing too. Neck or discomfort in the arms, back, jaw. Um, Lightheadedness, nausea, breaking out in a cold sweat, um, and irregular pulse, decreased blood pressure. But you'll feel the shortness of breath and anxiety, and actually even just feeling more tired is what women get more often than. So if you're in the home and some of these symptoms start happening, call 911. I mean, you could always cancel 911 if you're wrong. This way you've got them coming because there's treatments that could reduce the size of the heart attack. And if you're working in a facility, sometimes there's those in between times. Always tell a supervisor, but don't be afraid to call 911. Now, if you're working with someone who is not having a heart attack symptoms, but you know they have a history of heart problems, some of the things you could do is just make them comfortable. And sometimes the breathing is because the heart pumps through to the lungs and things back up. If we sit them up, they may be more comfortable with their head and chest elevated. Okay, another heart disease is the congestive heart failure. Now it's just often known as heart failure, but what happens is if the heart can't pump, it backs up in the fluid backs up in the lungs. So people and because there's two sides of the heart, the other place it backs up is in your whole body, but mostly your feet. So common symptoms, fatigue and weakness, heart palpitations. Sometimes they can feel the heart going boom, 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 boom. Shortness of breath, loss of appetite, swollen feet and ankles. Now this is something that you want to report to either your agency or their supervisor because sometimes they just need a little bit more medicine, especially for the swollen feet and shortness of breath. And that sometimes has to change from day to day. Besides looking at the clogged reasons for heart disease, the clogged arteries, some of the other reasons that they have ineffective heart function is high blood pressure, have poor heart valves, um, and then we went through the coronary artery disease, but also long-term alcohol abuse could cause heart disease. Last two diseases we'll go over. One is seizure disorder. And this is caused by uncontrolled electrical activity in the brain. And I have a little picture here. So this is, I don't know how to read these, but that's what they look at, the waves in the brain. This is a non-seizure patient. You can see there's ups and downs, but mostly flat. This is a seizure patient. So they're looking at different areas of the brain. But when you go down here, this is where it's probably most active. Look at the difference in activity of the brain, and that's all electrical activity. And so, what causes seizures? Sometimes they don't know, other times it's tumors, head injury, fever, electrical imbalance, or strokes can cause it. If they have more than one seizure, have a few, repeated seizure activity, that's called epilepsy. Then you've got that disease. If you just have one seizure because of a high fever, it's not epilepsy. The treatment is usually medication, doesn't always work though, and there are others, but that's the most common. So your book goes into all the different seizures, and honestly, I just want you to know there's little seizures all the way to big seizures. So the littlest one, the petit mal, it could just be especially with children just looking and staring blankly in the space. right? And you may think they're just daydreaming, but it only usually lasts a few seconds. Then there's more bigger seizures, and sometimes they get an aura or a warning. They either get a smell or they see lights. They may be confused, look confused, but they know may know it's coming. Then there's the generalized tonic-clonic seizures. Okay, so where they're really convulsing like this, and with their eyes closed, they could turn. They get stiff. They get blue around the mouth. Their muscles tighten, and it looks like they're not breathing, and they really are getting less oxygen, and it could last 5 to 20 minutes. So you want to try to figure out how long it's lasting so you could tell someone. Okay, so someone who's static epilepticus, they keep having these repeated big seizures. Those need to be treated. I mean, they all need to be treated, but if they can't stop the seizures, they could die. Uh, so most seizures do stop on their own, and they last less than 5 minutes or so. But stay calm, help the person down to the ground if they know it's coming, and put a pillow under their head because we don't want them to injure themselves hitting their head on the floor or fall into the floor. Once they're done, you could turn their head to prevent choking, but during the seizure, you just want to prevent their head from hitting hard on the floor or possibly their arms on a chair or something. So move the furniture away. If the person's in bed, and they have side rails, sometimes we pad those with blankets or pillows. Don't try to hold them down and just stay with them until the seizure is done. Usually the person doesn't remember what happened after the seizure. They also may be incontinent of urine and feces even if they're not. So if their bowel or bladder is full and once their muscles get tightened and then they relax, they may be incontinent. Offer support to them, and of course report those seizures. They usually happen so fast that you're trying to keep them safe, and then they're done. Okay, the last disease we're doing are strokes. So strokes, first of all, bring a lot of people to live in assisted living and skilled nursing or need help. So let me explain what a stroke is. Sometimes they call it a brain attack because the reason is often the same reason as a heart attack. And what it is damage to brain tissue caused by an interrupted blood supply to the brain, usually due to a blood clot and buildup of plaque. So there's already a buildup of plaque, narrowing of the artery, and then a little clot is the one that ends up just stopping all of the rest of the blood flow. But it also can be to a hemorrhage, but that's like less of the cases. More than 80% are due to this blood the blood clot and the buildup of plaque. So here, I'm going to make the picture bigger because I want you to look at that. Okay. Um, and this is the ischemic blood stroke. So that's interrupted. So what it's trying to show you there, a thrombus is a blood clot. So it has bad circulation to the brain. And then the blood clot just does it in. Okay, which means it stops the rest of the blood from getting through. A hemorrhagic stroke, which is like less than 20% of the cases, is when the blood vessels actually rupture. And that's usually more somebody's had weak blood vessels all their life and then they burst. Um, so some of the warning signs are numbness, tingling, or weakness on side of the face, arm, or one side of the body. They could be confused. They impaired vision in one or both eyes, dizziness, loss of coordination, trouble speaking, and a sudden severe headache. So with strokes, there's an acronym out called FAST, F-A-S-D, and F stands for face, and look at the face is drooping, an uneven smile. So sometimes the symptoms are minor, so ask the person to smile, and then you'll really see if one side doesn't go up. Arms, if one arm is weak, ask them to hold their arms out and squeeze your hands. Their speech is slurred, but then it clears up and then it's slurred again. Slurred, that you can't understand it always. And the T stands for fast. You want to call 911 for fast immediately because if it's due to a blood clot with the plaque, if they get them to the hospital on time, within a certain amount of time, within the hour, they can give them some clot buster medicines that will prevent from having further brain damage. And just so you know, some of the people that have strokes, they're going to lose control of their muscles and some of their thought processes. I mean, they've had brain damage, so they uh, they may know what they want to say, but they can't say it. They may say yes and mean to say no. They're all affected differently depending on how big a stroke and what part of the brain is affected. Okay, in the stroke patient, they could have a Okay, so the patient, after they're done with a stroke, depending on how much brain damage, they could have hemiparesis, which is just muscular weakness on the one, and it's always on the one side. So it's either going to be on the right side of the body, or the left side of the body. And they may be able to move, but they don't have feeling in their limbs. And so then you have to watch out that they don't hurt themselves by bumping something, getting burns, scrapes. And then they also could have hemiparesis. Then they also could have hemiplegia, where they have total paralysis on one side of the body and no feeling at all. Okay, there's generally three stages in the recovery period. The first is when they're flaccid, the affected side is just weak and just limp and weak. The second one is where those muscles may tense up, and that's when they start to just bend and they're really hard to, they have spasms, and those things hurt. Then the third is the recovery period where hopefully they regain their normal use, but they may not, definitely may not. This is long term, but hopefully they've regained some of it. Okay, when someone has a stroke, we want to prevent complications. So one thing is to reposition the patient because they're hemiparalysis, right? They can't move well on one side. They can't move on one side. Help the resident reposition often to prevent atrophy, that's muscle breakdown, and we're going to exercise them. And contractures. Contractures are when your ligaments and tendons tighten up in your joints and you can't straighten them. So your arms are like this, your hands are like this, your knees are bent like this. Um, Provide good skin care, prevent injury by providing safety measures of, like, if we're helping them get from the bed to the wheelchair, using the gait belt, transfer belt, walkers, and assistive devices like. Okay, every stroke is different, but some people have it's ruined their vision. So it looks like they could see, but they could only see part of what's in front of them. Like they could see from here to here, but not over here. And and we're just going to have to ask them if they could see the whole thing. So you're going to place the daily care items within reach, but in their visual field. So they may be able to see more on their left side than the right side. Allow communication time, and then a lot of times what helps are these communication aids, these communication boards. So it's a board with pictures on it that they can point to. They have to go to the bathroom. They have pain. They they want water. And then be alert for sudden mood changes. It happens, but it's really scary because you're talking to someone and they're like laughing, and then all of a sudden, within a minute, they're crying or almost crying. And so, no, it's not you. I, to try to just maybe stay there, stay calm, hold their hand. Don't make a big deal out of it. Like, what's the matter? What's the matter? Because they just need to relax. They can't help it. So it's good to stay with them, talk to them softly, but sometimes it just takes time. And lastly, there's a great video, and this is a doctor who had a stroke, and she talks about, she obviously got better, but how she felt when she had the stroke and describes it really well. And yes, she's holding a real brain in her hand. So that'll be in the modules.